Hi everyone. The book I chose to read is Black Women in White, Racial Conflict and Cooperation in the Nursing Profession from 1890 to 1950 by Darlene Clark Hine. In this book, it talks about nursing being the most female of all professions. Black women were drawn to nursing for a variety of reasons. It could be identification with the nursing role, self-fulfillment, care for others, making a difference. And unfortunately, they were often deterred from other career paths. They not only faced the gender biases, but they also had to overcome racism, including racial exclusion and segregation. Black Women in White explains the challenges in development of training and workplaces for the Black nurses and the additional hardships they faced with the professionalization of Black nursing versus their white counterparts. So pedagogy of history is what shapes our thinking, identity, and it allows for exploration. From the beginning of America, Black women acted as nurses. They provided health care to both Blacks and whites. They nurtured the sick and helped deliver most babies. They provided treatment to the soldiers of the Civil War, and they were not paid for any of these efforts. After the Civil War, the American Medical Association recommended formal nurse training for those who provided nursing care. Formal nursing schools were developed and certifications were required by law. Hospitals acquired the dominance of providing care for the sick, increasing from only 178 hospitals in 1873 to over 6,000 hospitals in 1923. Evidence in history is what bears witness, what gives voice, and dispels myths. In Ms. Hine's book, she talks about that Black women were actually denied access to these training schools and hospitals, which led to the suffering of patients in the Black community. The Black community, though, they joined together and they pooled their resources to create Black training schools and hospitals. Despite this, Black nurses continued to fight an uphill battle as Black women were required to go to school for 4 years rather than 2. As their white counterparts were, they were given different certification tests and they were given more responsibilities. They were expected to also do household tasks and provide child care. Black nurses bore the bulk of the responsibility for health care of the Black community. They had the daunting task of gaining the trust of the Black community. Patients rarely sought treatment until they were gravely ill due to fear and distrust of hospitals due to racial discrimination. As attempts to move nursing as associated with domestic tasks into a profession, subordination and discrimination against Black nurses continued. Professional organizations, demands for better working conditions, and wages were all developed, yet they excluded Black nurses. New laws for standardization of curriculums and testing provided additional barriers for the Black nursing community. The National Negro Health Movement was formed, and they focused on ways to improve the poor health status of the Black community. History as an explanation provides context, explains the present, and helps us to look forward. Black nurses' work was generally limited to segregated Black hospitals or private duty until public health was added in the 1930s. It was not until World War II that the expansion of Black nursing reached beyond these restraints. Black nurses were not fully integrated into hospitals until the 1960s. Black nurses were considered inferior members of the nursing profession and had to fight harder for professionalization. The National Association of Colored Graduate Nurses, NACGN, was founded in 1908 and fostered a great sense of professional nursing and organization involvement and encouraged postgraduate education, establishing a special scholarship program so that it would be more easily accessible. Black nurses became more determined than ever to not tolerate a subordinate status, and they attacked the walls of segregation. White administrators blamed Black nurses for all their shortcomings in not being able to get to supervisory positions, even stating that they did not possess the capacity for responsibility of supervision and needed firm, white, competent direction. The NACGN was key to the integration of Black women into all levels of American nursing. Despite multiple barriers, constant struggle, oppression, and opposition, Black nurses have become professional nurses, fully integrated into all levels of nursing. This country must not forget the plight of the Black nurse. In conclusion, Black nurses are and always have been a vital component to the complex system of healthcare delivery. They are intimately involved in their communities and have been the driving force in improved health of Black communities. They contributed to the growth and development of their profession despite multiple barriers. The essential difference in professionalization of the Black nurse and their white counterparts is the powerful impact of racism and the struggles they faced because of it. I highly recommend this book to everyone. It is very interesting to see the different struggles that African American nurses faced versus what other people faced. Thank you.